Hello and welcome to In Depth with TommieMedia. I'm Emily Haugen. St. Thomas announced plans for the Morrison College of Health this week, with the goal of improving health for underserved communities. To achieve that, the college will combine a new school of nursing with existing programs like social work and psychology. MayKao was named the founding dean and vice president of the college in early September. Today, Hong will discuss her vision for the future of St. Thomas's College of Health. MayKao, thank you for joining us.
You're welcome.
So, in the press release announcing your appointment, President Julie Sullivan stated the school's mission involves social justice and engagement with local underserved communities. How will you accomplish those goals?
Some of those goals will be accomplished through forging strategic partnerships with clinical partners in the community, talking to large employers in town who would be actually hiring graduates of the different schools that we have. And then because the work at St. Thomas and within the College of Health, there's a very strong community service component. There'll be work with local nonprofit organizations, others who are actually wanting St. Thomas to do outreach and engaging students in a service capacity, completely outside of clinical placements. So lots of different reasons to be excited.
Yeah, very cool. Are any of those partnerships already kind of in the works?
Yes, so literally when I was named founding dean, I had people in the community very excited about me starting at St. Thomas. So a number of them have reached out, and I've already enlisted or gotten 2 people to agree to be on the advisory committee for the new College of Health. And then we'll also be working with existing partners to see if there could be an expansion of those partnerships. So I'm actually in my first week doing a lot of assessment about who we already know, where we need to go, who's missing from the table, and then what perspectives we should be building in.
Oh, that's awesome. Mm-hmm. So as the former CEO and president of the Amherst H. Wilder Foundation, you designed programs addressing inequality in the community.
Yes.
So how does that experience in social services translate to this academic position?
Yeah, so I have a doctorate in public administration and studies in social justice, and also the distribution of how we collect actually public dollars to create more equity in the world. And then I come from a direct service background. So that's the foundation of my knowledge. I've basically spent 2.5 decades working in the fields that students would be graduating from and then being placed in. So I'm actually bringing an industry perspective into the College of Health. And then because my previous job with the Wilder Foundation, we had a very large research enterprise, Wilder Research, which does a lot of applied social research and evaluation in the community. I'm also bringing that research perspective into the College of Health. And literally for the 2.5 decades that I've been working out in the community, I've been working with health providers, health insurers, county government, all those. So I'm bringing that network of relationships that I've built over my career since my 20s, actually, to the University of St. Thomas.
Oh, that's awesome. So, the announcement revealed that the Morrison College plans to work with other corners of the university, like the Opus College of Business and the School of Engineering, to make a more holistic learning experience. So, what makes this program different from other universities?
Yeah, so I think that St. Thomas is a unique learning environment. It's headquartered in the capital city of Minnesota, which is pretty special. St. Thomas has also had a very strong social justice, service-oriented perspective throughout all the years. St. Thomas has been more practitioner-oriented. So growing from a place of strength with the reputational capital that we have, and also with the existing relationships that we have, not just through the College of Health, but all of our existing relationships through the College of Engineering, through the business school will be very exciting, because the reality is healthcare services and health delivery is changing a lot with the use of technology, with how we're looking at data analytics, and more the leaders of the future are going to come from the fields that are from the college, because what we need more of in society today is people who are serving the greater good, people who are understanding that it's really not only about a profit motive, that it's about how life is very precious and how we together actually work to preserve, to prolong it, to help people stay well instead of just intervening when they're sick. So there's a lot of reform in that needs to happen. In the College of Health, we'll be educating people for a lifetime of leadership and an orientation towards doing good in the community.
Fits right in with St. Thomas.
Yes.
So what are the big goals that you personally have for this college over the next 5 years?
So in 5 years, the School of Nursing will be up and running. Hopefully, I'm very ambitious, so I'm hoping I'm going to work hard to actually make sure that undergraduate and graduate nursing is up. There may be a consideration of other types of health professions. I look at health through the perspective of the community and how we keep, how we do policy and advocacy and how we actually keep more populations well. That's really from a public health perspective and a policy perspective. So hopefully that's going strong. And then the other hope, and we're working towards this right now, is to actually develop a college where we are integrating from a cross-disciplinary sense, taking the best of what we know from other fields to actually do smart design and thinking about how to keep communities well. And hopefully there'll be room for experimentation with course loads, looking how we can actually partner with other colleges, and then also placements in the community so that people can build the skills that the health delivery system and the community is needing for the future.
Well, that's really exciting. So MayKao, thank you for joining us today.
You're welcome.
So if you have a suggestion for an in-depth segment, tweet us at TommieMedia. With MayKao Hong, I'm Emily Haugen. We'll see you next time we go in depth on TommieMedia.